But while she's setting you up, until she tells us she's ready, I'll say, thanks for coming. I'm glad you're here to tell us about that.
Oh, thank you. I've been talking with Mel, and Mel's been really helpful in getting me connected, you know, with people to try and get the word out about this. I appreciate you having me, letting me speak for a couple minutes during your meeting.
Do you have a tennis background yourself? Uh-oh. Heather? Thanks. I think Heather's frozen.
Maybe you're frozen. Your screen is. Sarah.
Hey,
oh,
Joe,
there you go.
Okay, you're back. That happens to me every meeting, and I've already had one, so.
You were about to ask me a question I didn't hear.
Okay, I was just asking if you have a tennis background yourself. If you've been...
So, no, I'm a terrible tennis player. I do play, but my son plays a lot of tennis, and my daughter is starting to. So that's kind of where this all started.
And is either of your children, you said, on the spectrum?
No.
No.
How we got into this is sort of twofold. One, with my son being a tennis player, and we do have some extended family members that are on the spectrum. So I have a little bit of a soft spot especially for kids on the spectrum, as I know all of you do. And then with my son playing tennis, we came across this organization and thought, wow, this is really cool. Let's see what we can do with it.
That's awesome. And you're in Lexington?
Yes. Yeah. Okay. So are we good to go, Joe?
I think so.
I see a sign that says meeting is now streaming.
Oh, it says live.
We're
Okay.
good.
All right. Okay. Heather Richardson is going to tell us about a tennis program for individuals on the spectrum.
Yeah. So it's called, first of all, thank you very much for allowing me to be here tonight. The program is called Acing Autism, and it was started by a pediatric neurologist and her husband, who's a big tennis fan, several years ago in Boston, and they've since moved it to the West Coast. But it's a huge organization within the U.S. It's a nonprofit, and the whole idea is to give kids on the spectrum a chance to just have fun, play with some other kids in a very safe, welcoming environment, get some exercise, build some social skills, that kind of thing. And so what we're doing is starting the first program in Kentucky, which I'm really excited about. So they have it all over different states, but Kentucky does not have it at all. So I'm sort of running the program, and my son is the volunteer coordinator. He's 15. And so what we're doing is the Lexington Tennis Club has generously donated the space. We're starting small. We're going to have a clinic with 8 kids, and we have 4 signed up right now. We're looking for kids between the ages of 5 and 18. We've got 4 signed up, so we're 4 more. So if anybody knows, immediate family or friends or anyone that you think might benefit from this, please spread the word. I've posted the information as well on the Autism Society of Bluegrass Facebook page. So there's information there. Mel also has my contact info, and I can give it to you. We're starting October 11th, Sunday. It's going to be Sunday afternoon, 3 to 4, and it runs for 6 weeks. And what we're going to do is, everyone's asking, of course, about COVID. So all of the volunteers have to wear masks at all times. The participants do not, unless they want to or feel comfortable doing so. And each kiddo will be paired with a volunteer. Okay, so typically when we do this, they'd be right next to them, if they need hand over hand prompting, that kind of stuff. But because of COVID, what we'll do is we'll have them across the net. And we're getting extra volunteers so that we can help with that. So we actually have quite a few teenagers, like high school students, university students that play tennis that have signed up, which is really great.
That's awesome.
And just trying to think what else I can tell you. So it starts October 11th, 3 o'clock Sunday afternoon. The cost is $120. However, we don't want cost to be prohibitive for anyone from participating. So because it's a large nonprofit, they do have scholarships available. So if that's something that you're interested in, you can let me know, and I can put you in the right direction there.
Tell me the cost again. I'm trying to keep notes.
It's $120 and that's for 6 weeks. So it'll run weekly until, let's see, I guess the last day would be November 15th.
Okay.
And we're just so excited to be able to offer this to kids and any child between age 5 and 18. is welcome to join. And I just wanted to put the word out there.
Great. That's great. I will look for, I will look at our Facebook page and paste it into an email on our listserv.
That would be great. Yeah, and there's a flyer in there. And I can also, if you want, I can give you the email address.
Was it not in what you
It
put
should be on
there?
the flyer. Yeah, it's on the flyer. So
Okay, should
yeah.
be good.
Yeah, and Mel has my number if anyone has any questions.
All right. I'll send it to, I'll send it also to the Fayette County Public Schools, unless you already have, let them know.
No, I have not. That would be wonderful.
Okay. The Parent Resource Center, I'll send it to them. Okay.
Yeah, that would be great.
All right. All right. Well,
Thank you.
Well, thank you, Heather.
Thanks, Sarah. Does
Appreciate
anyone
that.
that's on the call have any questions about it? Okay. Thanks so much.
Well, Heather, thanks so much for doing that. I think it sounds really exciting. You already have 4 and you're looking for 4 more.
Correct.
Okay.
And if there's a need for it and people like it, we'll plan on doing another session in the new year.
Okay. All right.
Yeah.
Did you say where you're having it?
Lexington Tennis Club.
Lexington Tennis Club. Okay. Well, it'll be in the flyer also.
Yeah.
Okay. That sounds great.
Okay. Thanks so much, guys. I don't want to take any more of your time.
Well, you're welcome, by the way, to stay and listen in on the whole meeting or leave if you'd rather. You're welcome.
Oh, I appreciate that. Thank you.
Yeah. All right. Thank you, Heather.
Take care.
All right. Let's see. I think we have Vibert. Do you want to do an introduction of yourself? We've gone around and you are muted.
I think I finished it on mute. So do I have to go over again?
Just so you know, we are live now, Sarah. So.
All right. Well, it's okay. All right. Sorry,
So
I didn't think about that, Joe.
Yeah, that's okay. I mean, it's completely up to Vibert if he wants to introduce himself. I'm totally cool with that. But I just wanted to let everybody know that we
Well,
are live.
that's
on
okay. Vibert, I'll let you off the hook.
Okay, good.
All right.
Thank you.
But welcome. Okay. So I think that covers what we had to needed to cover up before our main presentation. And many of you probably already have seen the flyer, but our topic tonight is the Medicaid waiver update. And we will hear from 3 people. That our primary contact has been Pam Smith. And I'll just briefly say that Pam is a registered nurse and holds a bachelor's degree in business management. She was born and raised in Kentucky and has a passion for the people Medicaid serves. So I think she's brought on a couple of people to provide backup and assistance. And so I will turn it over now. Pam, if you are ready.
Thank you, Sarah, and thank you for inviting us. So I am the division director with Medicaid, serving the Community Alternatives branch. So we oversee all of the 1915C waivers. Also on the meeting with us is Alicia Clark, who is my assistant director, and April Lowry, who is one of our branch managers.
Welcome to everyone.
Let's see if, Joe, am I able to share my screen? Oh, it looks like I'm going to be able
you
to,
should be
so,
able to do
okay.
that.
Let's see here. Y'all let me know. Can you see the presentation?
Yes.
Okay.
Yes.
Now will be the next thing is if I can get which monitor that it wants me to control the presentation from to work. That's the next fun thing here. Let me see if I can move it to actually what I'm going to do, I'm going to stop the video just so that I can do this, and then I'll come back on to answer questions because it's not wanting to show it on the same screen that my video is on. So I'll stop that for just a second so that I can share it on one of the other screens, and then I'll come back on to answer questions. Okay, so tonight we are going to cover, I want to give an update on Ppe Waiver slots, our waiver redesign status, an upcoming public comment period that's going to start in October, our waiver help desk. It's nearing 1 year of service, some updates on what's going on with MWMA, and also updates on electronic visit verification. So first, in exciting news for Ppe Waiver, on October 1st, 100 individuals will be that are on the wait list currently will be sent allocation letters. Those individuals will have 45 days to request an assessment. The last day to request an assessment is November 15th. The community mental health centers have 14 days from the request date to complete the assessment. And we do give the CMHCs advance notice so that they know that those slots are being released. And then the assessment must be submitted no later than November 30th. Now, the Ppe Waiver year just ended and restarted in September, the beginning of September. So we are hoping that after we release these 100 slots that we will also have some additional slots once we actually look at the individuals that either have left the waiver, have transitioned to maybe SCL, but we were able to at least initially release those 100 slots. So waiver redesign, there was a letter that went out in February talking about that it was paused. We had paused to speak to since we had a change of administration originally, we had paused bringing them up to speed. We were in the full process of that, restarting meetings, and then COVID hit. So we have been very busy trying to deal with COVID and to make sure that our individuals are still able to access services that they need, as well as making sure that everyone is getting the services they need to have their health, safety, welfare addressed. We also want to reevaluate all of those recommendations, make sure that, coming out of COVID, that there's not things that we've done differently that maybe we want to roll into waiver redesign. For example, one of those is the expansion of telehealth. That has worked really well for some individuals. And so we want to look at, the things that have worked really well, maybe being able to continue those outside of the state of emergency. We don't have the date for resuming the official redesign, the larger project yet. We will notify stakeholders when that is going to begin again. We are still, though, taking any comments, concerns, as well as if you would like to sign up to be on the email distribution list to get updates. If you email Medicaid public comment at ky.gov. And Melanie, I can send you this presentation after, and you can share so that everybody will have the links. Nobody has to try to write those down right now, that they'll all be in there. Something that is happening in October, the waivers is when we write them to CMS, the funding and the waiver is good for 5 years. But every 5 years, we have to look at those applications again and those waiver amendments, and we are given the opportunity to make any updates or changes. This year, it just happened that both Hcb and the Model 2 waivers are up for renewal. We are in the last stages of doing final editing checks on those, and October 5th, we plan to place those for public comment. CMS requires a minimum of a 30-day period when we put those renewals out for public comment. So right now, the target dates are to go from October 5th to November 6th. We did put a couple extra days in there because of election. Sorry, one thing that we will be doing, look, I couldn't get it to move and now I can't get it to stop, sorry. One thing that we will be doing is on October the 12th, which is about a week after the waivers are published, we will have at least one webinar, depending on how many people attend or the request, we may have a second one. It will be recorded though and available for individuals to rewatch, but it will outline what changes that we are making to the waiver. One of the things we can't, we're not able to change the rates right now, but we're writing for more clarity, and we're writing to expand some of the services. For example, home delivered meals. We found through the state of emergency, our increase in home delivered meals went up. Oh gosh, it was a crazy number. It was like over 1,000%, which really spoke to the fact that we needed different options. So we'll be expanding home delivered meals to not only include hot meals, but also to include frozen meals. So it will give individuals more choice, as well as hopefully meet more needs. A couple of the other things that we're doing is we're going to update the current waiver processes, which will include the service authorization changes that went in November, changes to incident reporting and appeals and grievances. As I mentioned, the home delivered meals. We're also going to be updating the policy for hiring legally responsible individuals. It makes it more clear on which LRIs must receive approval to be hired as a participant, as well as it makes the criteria a little more clear, and defines natural supports better. And it specifically says, right now, one of our constraints is it mentions that if you've ever provided natural supports for an individual, that you always would provide those natural supports. And we all realize that, it is not expected that, that you would be providing some of those natural supports for an adult child. So we really wanted to make it easier and to make for those individuals to be able to provide the care to their loved ones. We also are going to expand. Right now in Hcb Waiver, it is only our areas of aging that can serve as that financial management support broker role. We're going to add the CMHCs, which will increase the choice to have at least 2 per region. For Model 2, we're really just updating the current processes for service authorization, incident reporting, and appeals and grievances. So, and that Model 2 waiver is it's our smallest waiver, and it's for individuals that are ventilator dependent or who are on an active weaning program from the ventilator. I wanted to tell you a little bit about our waiver help desk. So as I mentioned earlier, it started in November. We take on average about 450 calls per week, and we take calls from individuals, from their representatives, from case managers, from other service providers. It takes about 25 seconds to answer a call. So that means on average, individuals are on hold for no longer than 25 seconds to speak to one of our help desk attendees. Our top reasons that we get are questions about the Michelle P. wait list, how to apply for waiver services, and case management or other service questions. You may have heard from your case manager or support broker. They're going through some intense training right now for from enhancements that are coming out for MWMA. We are expanding access to all providers, not just the case managers. So that means that providers can use MWMA to keep service notes, they can print prior authorizations on demand, and they can see the participant's full plan of care, including goals and objectives. Right now, that is limited to only the case manager. So that will give them more access and means for improved coordination of care for all participants. It will go live in October, but the deadline for providers to begin using MWMA to report critical incidents is December the 1st. Right now, the process that they have to do that is basically they have to fax that in. So they have a form that they, some people actually still write the information on the form, or it is a writable PDF so they can type in the form. But And then there's a lot of manual tracking that goes into that when we receive that. So this will now be a centralized location where we can see all of those incident reports, as well as there are tasks that are generated for case managers to follow up, for providers to follow up, for us to follow up and see what is going on with our individuals' health, safety, and welfare. So it allows us to better track that. And probably the most exciting topic right now, and what I know that everybody has questions about, is electronic visit verification, also known as EVV, honestly, because electronic visit verification is a mouthful to say multiple times. The use of EVV is required by the 21st Century Cures Act. It was signed into law in 2016. However, we've had, there was a delay, and then we as a state applied for a good faith exemption, which gave us until January 1st of 2021 to implement it. If we do not implement it by January 1st, 2021, for our waiver populations, we risk losing some of our federal funding for waivers. This EVV is an electronic system used to record information about provider visits who are delivering in-home personal care type services. We are required to capture 6 pieces of information, which is the date, the time and location of services, the type of service, the name of the provider, and the name of the recipient. Provider agencies, both our traditional and our FMA, so traditional providers and those that provide participant directed, they have 2 options for EVV. One is the state-sponsored option, which is TELUS. That one is free for providers to use. They do not incur any costs. The state incurs all the costs for that option for the providers. And then provider agencies and FMAs can also choose their own third-party EVV system. I believe we have between 8 and 10 third-party vendors that are actively in the process of testing right now between their system and the TELUS system. We're encouraging all PDS employers, their recipient and employees, check with your FMA to see which system that you will be using. They also should be communicating with you about training and what trainings that you need to attend, whether it be the ones for the TELUS system or for a different third party. Some important dates around EVV. Training begins in October. It begins the first full week of October. In November, we have a pilot that happens early November, and then what we're calling is a soft go live on November 17th. What that will do is that all providers can use the system. However, they don't have to use it for every participant. They can choose, a portion, 5 or 10 of their participants. They can begin scheduling the visits, begin billing their claims. It really allows them to get used to the system before they have to have everyone onboarded. On January 1st, 2021, for all dates of service that begin January 1st, 2021, the provider agencies and the financial management agencies must begin using EVV to comply with the federal requirements. We have had multiple town halls. Our final one will be on October 14th from 10 to noon Eastern via Zoom. You can register for that recording, or for that meeting, or view recordings of previous meetings on our DMS website. And again, we'll send out this presentation so that you have those links. There's also a link to the EVV FAQ on that website. We are working on putting an update out there for that. Additional resources that are on the EV website are kind of those one page, if you have followed us through Waiver Design, those what does it mean to me documents, what EVV is, how to prepare. There's one that talks about the technology requirements, that talks about project timelines and training schedules. This last one, some ideas about or some additional websites or phone numbers that are useful. So we have our overall waiver program website. We have the help desk, both the phone number and the email. How to subscribe to those email updates or make a comment at that Medicaid public comment. And then we also have an updated, and we're actually in the process of making even additional updates to it, the document on who to call for waiver help. So if you have a question about eligibility, who do you need to call? If you have a question about services, who do you call? And so I will get that, I will get that presentation out. Melanie, can I just send that to you and you can distribute it to the group?
Of course, yeah.
So that that is out there. Oops, sorry, I obviously cannot work buttons today. So I will open it up now for any questions, and then I encourage you, if you're like me, when it's over, I think, wow, why didn't I ask that? I forgot about that. Please feel free to. I know my email address was in the flyer. That Medicaid public comment, as I mentioned, that is monitored daily. And then also the help desk. So, that is answered live. There are agents on the phone from 8 to 4.
Pam, there was a question in the chat about, can private identifiers be used in place of names for privacy?
Evan, can you maybe give me a little bit more kind of around that question, a little more context? So
okay, so I asked that question and I have been following along, and I understand that the app is HIPAA compliant, but we in our circle have had some technology breaches over the last week. And I know that anything that's on a device is not really protected by the app's security features. So if a patient's name and other medical information are recorded on the device, even if they're in the app, I have concerns about the privacy of that information, especially since it's a bring your own device option, right?
It is.
So
it is the information is stored on the server, and I will. We actually just finished penetration testing, which includes where we have some very intelligent people, much more so than I, that's with both our security team and the TELUS team. That's actually what they do, is they try to hack the application to verify its security, and that is done. There's security testing that is done monthly, and then a larger amount that is done quarterly.
Right, so that protects anything that's inside the app. I'm sorry, am I loud?
No, you're fine.
But the information that's recorded in the device,
it does not. So anything that is on the device would only be related to a specific visit. So it would be a check-in, check-out time, and then the signature of the individual or their representative if someone signed for them, and the caregiver's signature. All other data is maintained within the actual servers. It's not maintained on the device. None of the personal information is maintained or stored on the device.
so like names, addresses, phone numbers, plan of care information, or service details or notes aren't stored in the device.
They're not stored on the device themselves, no.
Even
The device can access them, but they are not stored there.
So I have a question. So with the EVV system, I know that a lot of our PDS people, because I'm one of them, we take very detailed notes about like what's going on in the day-to-day activities. Will we still do that the same way we did previously, and that's just the timesheet part? Or will those two things be separate, or?
So that's one of the things actually that we have really been looking at is the amount of documentation that has been required. I have gotten, multiple copies of, I've had individuals send me copies of timesheets. We've really looked at that. And so this will be essentially your timesheet and your documentation. If you all are using TELUS, I can't really speak to those third-party vendors because I know several agencies use Mainzel, and Mainzel is one of the third parties. So if the agency chooses to require something different, but we are modifying the documentation requirements and really simplifying them. There's a lot of, you'll see it's basically check boxes. And so when a visit is scheduled, you'll say, for example, I'm going to work on personal assistance, and these are the tasks that I complete. And so then when you check out at the end of that visit, it is truly as simple as you checking off that task, that you completed that task.
Okay, so I have one other question. So what I've read so far is that it's like you set a schedule, right?
Mm-hmm.
Now, a lot of our PDS people, we're also parents, and we don't necessarily go by a schedule. Like we're supposed to have so many hours per week, and then and the thing about it is, because we're parents, because we're with our kids all day long, a lot of times what ends up happening is we go over the hours, and then we have to backtrack and say, okay, where do I cut this? Where did we, where do I cut that parent versus care versus CLS worker? So how is that going to translate with the EVV system? Like, will we schedule like right before we do it, or?
You can.
Okay.
Yeah, you can. So, and you honestly, so you should get, your case manager should share with you, this is how many units of service, which most services, I think it's all except one respite that's in HCB, the services are 1 unit equals 15 minutes. So they should be able to share with you, this is how many units of service that you're authorized for a week or a month. And so then you can do one of two things or a combination of both. You could go in and schedule your visits ahead of time. If you want to say, I know that I want to plan that the time that I would bill would be, from 8 to 12 Monday through Friday. Or you can literally schedule the visit right before you do it. We've done it. We've been testing it over the past 2 to 3 weeks, and April and I literally have done kind of a combination of that. We've started them. She scheduled visits for me. I've scheduled visits for her. We've scheduled visits for ourselves as caregivers, and it's simple. It takes not even a full minute to do it. It's really easy, but you can do a combination of the two. And I feel like probably in the beginning, it's going to be learning what works best for you, right, and how you want to do that.
Because I know like with some of our days are really long because they're going out in the community goals, and then some of our days are really short because we did the goals at home because COVID.
Mm-hmm.
So yeah, and
yeah,
we don't know when COVID's going to end.
Exactly, not soon enough for anyone, I believe. But
Sure.
Who knew that this would still be going on? That we would be in at the end of September, and that we still would be talking about COVID, and that this would still be happening. So, but yeah, I think that once you get used to doing it, that you'll get kind of into a rhythm of what works best for you. And, if you don't, say you start the visit late, or you schedule it and you think you're going to start at 8, but you don't start until 10. And so you end up a visit that was supposed to go 8 to 12 now goes 10 to 2. You have the opportunity that you could put a note in there that just says visit started late. And that's okay. It's going to happen. Okay. It's real life.
Yeah. So we have a question from in the Zoom here. How will the employer review notes? It's actually 3 questions. How will the employer review notes? How will time be monitored by the employer? And will time be rounded up?
Okay, so I'll take the first two because they kind of go together. So the employer, so in this case would be the person that is actually doing the billing. So they have access through an administrative portal. We are still talking to TELUS about how the PDS employer or the participant, what their options are for going back in and looking at that. As the employee, you can go back in and review your last week. You can also share, at any time with the participant when, at the end of the visit, or, at any time you can share that information. We're working with TELUS right now to find ways to make that easier. For time to be rounded up, we actually are in discussions about that. As of right
This
now,
person is
in
confused
Kentucky,
about what you just said. They said the employer, the employer are the participants.
right, for PDS, that is true. For PDS, the employer is the participant. We are working with TELUS on additional ways that participants could have access to the system and could see the system outside of the employee sharing that with them. So there'll be more information to come on that. But as far as who will do the billing and who will get notified if it shows a visit was missed, which could mean that somebody forgot to start their visit, or because, I can tell you through testing, it's happened and we expect it to happen, that it's new and people are gonna forget that they meant to start a visit, or they're gonna just forget the visit altogether. And so there are alerts to the administrator that will be billing time that will trigger them to be able to reach out to someone and say, hey, did you miss a visit? You were scheduled, or it looked like you planned to have a visit this day, but we don't see any time log for you. Did you provide the visit? And if so, we'll put that in for you. So they can administratively put that time in so that you won't lose that time. But they are the ones that are alerted to do that before they have to before they bill the claim. It won't let them until they resolve that.
I want to ask just about that, exactly about that. So if you have scheduled a visit and for some reason you don't start it, say it's scheduled at 8 and you don't start it until 10. In one of the town hall meetings, Joe talked about how that would send a message to the FMA. And what happens in that process?
So it really doesn't send a message as much as it alerts on their dashboard, so that if I was the FMA and I logged in, on the top of the dashboard, there are some tiles, and one of them says missed, or says, I believe one of them also says late, and it would, there actually would show a number in that tile, and when I click on that, then it would show me who that was, who the employee was that was to provide the visit, and who the participant was. That way I can reach out and say, hey, is there something wrong? We look at this with our tradition. This is more on the traditional side, but for example, when we've had, adverse weather events, and it may be that someone was supposed to be going to someone's house to provide care, and they didn't show up because something happened in between, going from one place to the next. This allows that provider administrator to say, hey, wait, I have a visit that somebody should be providing care to this person, but they're not. I need to check to see if the person is okay, and or if they just forgot to hit the button.
Shouldn't that notification go to a representative or a parent or another emergency contact that can actually go and check on the person like right then? Because we definitely have a situation where agency employees haven't shown up and people are left alone. And if that were my kid, I would want that call first to me, even if it was also duplicated to the agency who may be closed. I need to know immediately so that I could get there if a staff member didn't show up.
So I will check to see what information can be that you could see as that employer, how the notifications could be sent out to other individuals.
That's important, I think. Thank you.
So that one other question was, will time be rounded up?
Oh yes, I'm sorry, I totally skipped over that.
That's okay.
So in today's world, time is not allowed to be rounded up in any of the waivers for any of the services. However, as we have gotten deeper into EVV, I've spoken to some of our other states. We are looking at that because, at this point, if you had provided, say it was a 15-minute unit, you had provided 13 minutes, it does not seem fair that you could not be compensated for that 13 minutes of care that you had provided. So we are actively looking at that right now, and so information will be coming out about that in an update.
So I asked a question kind of like this to the email address. So you work for 15 minutes and you end your shift and you go into the app and you're saying it takes about a minute to like get your device out, start it up, access the app, and record the end of your visit, right?
It's less than a minute.
And so, well, okay, like if you're doing a wet task, you don't want electronics nearby, right? I
Right.
was going to ask you before if you ever had to like get out of the shower and end your visit. Like if you guys scheduled tasks, like actual tasks like are going to be on that checklist. And if your shower goes too long, you have to get out and end it, or like, how does that work? But
well, we wouldn't, let me just speak to that. We wouldn't want you to jeopardize, just because the visit was scheduled to end, we wouldn't want you to do that and jeopardize the safety of your child or the participant that you're taking care of. We would want you to finish the task and then accurately reflect the time that was spent, even if it was over the time that it was scheduled to end.
so I think the problem with that is a lot of plans of care are just really written bare bones. And as parent caregivers, we're okay with that because like we're not in this to make a bunch of money, right? And so the time is really strict. And so like we're backing out, an hour or two here and there every day. But if there could be a penalty or a well check, instigated by missing timing in or timing out correctly, we have to know that so that we can plan appropriately, to follow the rules. And then, so my original question about the end of the time, like, are you on the clock when you're logging out, or do you log out off the clock? And how does that work?
So you actually, the portions of where you, in the visit, and you're checking off those tasks, that is all in wrapping up the visit.
So let's assume that's like 30 seconds at the beginning and 30 seconds at the end, right?
Okay, yeah, you can.
Like, I don't know if anybody actually has to arrive someplace and do a 15-minute visit and then leave, but it could happen.
It could. I mean, theoretically, they are 15-minute increments. I think the shortest that I've seen has been 30 minutes, and that really was more in Hcb, where maybe they had went to the store for someone, or they had done something, of that nature, and really weren't giving personal care or delivering any kind of hands-on type services. But theoretically, it could happen.
Or like toileting. If you have Hcb and it's really discreet, and you bill for toileting in the middle of the day and you don't have any plan of care services before or after that, it's tricky.
We have another question in the chat here. The question is there, if there is an overlap between two employees, who will determine who will be paid, or will both be paid?
Both will be paid. Now so the overlap, we wouldn't expect to see that it be, a 5 or 10 minute, we expect that a lot of times, that changeover, there may be, 2 to 5 minutes probably would be the most that we would see. But, if it went on and it was 10, 15 minutes, then there's actually an alert that will come up to the individual that is logging in that'll say, when they start their visit, it'll say that another visit is in progress. And so we'll cover, what you do with that when we go through actually the in-depth training. But they will both be paid. If both provided services, they will be paid.
This is Melanie. As far as like agency providers, if there has been any kind of crash, trauma, some kind of injury to the individual with had been with another employee prior to the transition to the new employee, will there be a place on the app for documentation of the critical incident?
Not within EVV. So within a critical incident would have to be completed outside, just like it would for any other type of health, safety, welfare event. That process remains in MWMA, and it would still, we expect that from any provider when something happens that impacts health, safety, welfare of the individuals. What you likely would see in EVV is where they would schedule a new person to cover that visit.
And just to follow up, in terms of PDS, if something were to happen, like the individual were to fall or something, happened during the time, would it be on how would the caregiver be able to access the critical incident?
So the current process is with PDS is that either the support broker or the case manager would assist in filling out that documentation, so they can provide a copy of that documentation that is submitted, as well as you have the right to any of the records, so they can provide that follow-up information. But they actually are the responsible party for entering that incident into the system when something happens. One thing with TELUS that they would be able to do, for example, say when they got to the individual's house, the individual had fallen, or maybe the individual had a question that needed to be addressed that the individual worker that's there couldn't necessarily answer. They can send a secure message within the app and alert the administrator at the agency to say, Ms. Smith has a question, would like somebody to call her about her services, or when I came to provide services, Ms. Smith wasn't feeling well. A nurse maybe needs to come out and see her, or it depends on the situation and what other services the individual is receiving. But it does allow for that real-time message so that that administrator would know, hey, I need to intervene here.
So you're saying those messages go to the FMA, to the TELUS administrator, and not to the representative or legal guardian of the participant?
So it does not go to TELUS. It would go to the FMA. And so, and then it depends on who within the FMA and the support broker. It depends on who that agency determines to be their administrators and how they do that. But yes, today it would go to their agency.
We have another question. The question is, are all waivers eligible for the home delivered meals? Can you say more about that?
So currently, while we're still under Appendix K, which is right now scheduled to go through March 5th of 2021, yes, all waivers will still be eligible for home delivered meals. Once that ends, it will only be the home and community-based waiver, so the larger HCB waiver, but we have seen such a large utilization of it, it will be something that we will look at when we pick Waiver Redesign back up to see if there are, if we want to add that into the other waivers.
We have another question here. It says, let's see, actually there's multiple questions. Okay, the first one is, how do Appendix K applications get submitted? Is there a preferred format?
So Appendix K is actually a formal document that CMS has that states use to modify services, and it has specific options that you can choose from, and you have to submit it on that application.
And the next question is, can an FMA have multiple administrators?
Absolutely, they can, and we encourage them to have more than one administrator. And let me go back real quick to Appendix K, that we only, Appendix K is used only at times of emergency. So, you know, there's been times where some of our southern states that have experienced hurricanes, or, you know, some that are in kind of the tornado alley that have experienced, you know, natural disasters related to that, or to fires, that the states have used Appendix K. It also can be used like we did in this situation for the pandemic.
We have another question here. Where can we get an Appendix K application? And can you explain what is Appendix K?
Okay, so the waiver amendments or the waiver applications, if you've heard us speak about them, and then if you've seen them as we've put them out for public comment, are made up of multiple appendices. So for example, there's one that deals specifically with eligibility of individuals and how we treat that. There's one, Appendix C is all about services and has the service definitions and who can provide the services. Appendix K is designed specifically for states that need to request assistance or modifications to services in order for them to respond adequately to a natural disaster or like a pandemic. And it is something that is available specifically to the state staff that are administering the waivers.
Can you talk about how many Appendix K applications you've had from the Bluegrass region?
So there's only, so when we fill out Appendix K, that is for the entire waiver. That is something the state fills out. It's not specific to a region or to a provider. It's actually amending the actual waiver application that the state holds with CMS.
Pam, is there a place we can go to read that document? Is that something that's just on CMS website?
It is on CMS's website. I will have to check with Kelly in the morning to see if we have posted that on our website or not. I'm not sure, but I do. Oh, April, I think April just stepped out. Yes, so it is on our website. Okay.
I'll put it in the chat, okay?
Okay,
the
thank
link
you.
to it.
Thank you.
And the link to EVV2 information, okay?
Thank you.
And it also, just to kind of, since you're sharing all this, I think that it would be helpful to see it, the memorandum of understanding or the contract that you have with this TELUS group, or you know what I'm saying? Because I think that might be of interest to people to review, seeing how there's so many questions around about that.
So pieces of that are protected by procurement. I do know that there are some that can be requested through open records. I'll find out exactly what can be shared versus what is protected by that process. I really, as I've said many times, I don't look good in orange. I don't want to go to procurement jail. So I'll find out what I can, what we're allowed to share, and then Melanie, I can get that to you.
You'll look fine in orange. I'm just kidding.
I'd prefer not to find out.
I think that there's so many changes afoot with all of this. There's a lot of anxiety, and I think justifiably so. It's
Right. I think a lot of things
scary.
happened at one time. It did. A lot of things have happened. You know, they weren't designed to happen that way, but then, you know, as I mentioned earlier, COVID kind of turned our whole world upside down, essentially, as you all know too, because you all are experiencing the same thing. So it is unfortunate that several things are hitting all at one time, but they're important things. So we chose to, you know, to go ahead with them and to not postpone them. And, you know, like in the case of EVV, we don't have the option. You know, federally, they provide about 70% of the money towards the waiver. So, you know, 70 cents of every dollar is funded by CMS. So we can't lose that funding. We wouldn't be able to serve the individuals.
Yeah, and I think.
Sorry, Mel. I was just going to say somebody posted in the chat box where Appendix K is located. They found it online, and they're posting it's April is posting this, and the EVV information where that's located. They're hyperlinks from the Kentucky.gov website, and I'm also posting those in the comment box on Facebook as well, so that way people can see them there.
Yeah. Something I was going to just say is that during this time of COVID, we have found that caregivers are essential, because with all of this, so many of the individuals that have been receiving care, all of a sudden, the people with traditional versus PDS were not able to actually go into the home, and the caregiver has taken on such an incredible responsibility to maintain and care for their loved one. And I just hope there's incredible amounts of respect that are being provided to this group of individuals, because my worry is that there's a perception that, you know, like somebody made a comment earlier, that we're just trying to make money off of our kids, and these are people that really care and love these individuals and have lived a lifetime. So I hope as we go forward that there's always that level of respect given to these essential, incredible people.
Absolutely. And I have been, you know, I monitor at least monthly the stats within our, we serve in total of the 6 waivers, we serve a little over 26,000 people now. And so part of what I monitor every month is, you know, who is getting services, who's getting additional services. And I monitor our incident reports related to COVID. And we have done, you know, and it's a tremendous job, and it really speaks to our family members who are caregivers and to our agencies, you know, that have also done what they could to make sure that individuals receive services in their home. We've had very few individuals that have tested positive for COVID, and actually at the last my last stats, I think we had 2 people that had been hospitalized, but the actual underlying reason wasn't related to COVID. They were hospitalized for one of their other comorbid diagnosis, not COVID. So I think that really speaks to the care that family members are providing, and that, you know, our traditional agencies are providing. So, you know, I think that, you know, we really respect you, and that's part of why, you know, when I mentioned the LRI criteria, wanting to make that easier, we realize right now it's not friendly to the participant, and sometimes a family member is the best person to provide care to their individual. But, you know, you all, if anybody's heard me speak before, you know, I'll get on my soapbox about respite sometimes, and that's important too. And so, you know, even when you're a paid caregiver, if you're a family member, you're also natural supports. And we want to make sure that you're aware of services that are available to you, because you can't be an effective caregiver if you're exhausted. You need to go to the doctor sometimes yourself. Sometimes you just need to get out, and that's okay. And so we want to make sure that individuals also know what's available to them and feel comfortable accessing those services as well, so that they can be an effective caregiver.
Okay, I have to say that I have offered to pay my respite provider 20 bucks an hour out of pocket. I had a doctor's appointment last Thursday. She didn't come, and I'm trying to hire somebody else, and I'm in competition with somebody who's in a different waiver who can pay twice as much. If anybody knows anybody that will come this Thursday for my next doctor's appointment, I've put these appointments off already for 6 months. I've got 20 bucks an hour for maybe as many as 4 hours if I have to wait. That's $80 so that I can go get my annual OBGYN checkup. And
Lisa, when is that? Like what time?
What?
Lisa, what time is that?
It's at 3
on Thursday?
Yes.
Dang, Thatcher has OT at that time, or I would totally be like all for it.
I know, man. I know.
Yeah. Next time, hit me up, okay?
You're not making me laugh. No, it's seriously like, and am I supposed to hire somebody who's a total stranger and leave them alone with my kid for 4 hours in my apartment?
That is the same issue that we were facing with Thatcher and respite. The same exact issue. I mean, you all know like what happened to him at school with people who were supposed to be trained, where he was supposed to be safe. And so now we've had to backtrack and say, okay, now who can we possibly trust with our child who cannot talk for himself? And we've hit a brick wall. So.
Okay, you hit me up too.
Okay.
I love Thatcher. Actually, I thought about calling you and asking if I could hire your husband.
You might do it. I don't know. But definitely talk to me about it off of this, but definitely for sure, because you know we really need to rely on each other, because we don't really have anybody else.
What we need is our own employment agency.
So what do you think about that, Pam?
Hey, I'm up for anything that you know that support each other. You know, if there's many times where we've said that, you know, if we could plop an agency down in one area, that we recognize that sometimes there is a shortage of caregivers. That's why I hope that, you know, we can get back to that rate methodology study and can really get back to looking at that, because, you know, right now, unfortunately, I think our caregivers, you know, you're competing with the Amazons and, you know, some of these other employers, and, you know, I hate to see that, but I don't have any magic answers right now. I wish that I did.
Well, so that's why I was asking the questions about Appendix K, because I think that they support an exceptional rate for respite, but our last service advisor just didn't know anything about it, and she wants photographs of every item that we're requesting, and she's not going to submit anything that doesn't have a doctor's letter of medical necessity.
Well, I think just to be fair to you, since this is also streaming live on Facebook, and I don't want to specifically talk about your situation, I will reach out to you can reach out to you directly and can talk to you about his case.
That would be awesome.
You know, I actually didn't know about any of the meal service stuff until this evening. There's a lot of stuff that, you know, caregivers aren't told, and we end up in meetings like this, and that's where we find out. So, I mean, that's where I found out about pretty much everything that Thatcher's benefited from.
Okay, so a couple of things that really makes me sad, but I also know it's a reality. So get signed up for, you know, that Medicaid public comment, those announcements. Go to our website and look. A lot of times, you know, when we do the webinars, we also record them now so that they're out there and available. And then, you know, just if you have a question and you want to say, hey, has anything changed? Is there anything new? You have my email address, that Medicaid public comment. That one I will tell you, I get literally hundreds of emails a day. Medicaid public comment is likely your best bet because there's multiple people that monitor that, and they will get to me if it's something that that I need to address or one of the other managers need to address. But use that, you know, and if you all can think of a way that we can get messages out, that more people, where we can reach more people, let me know any ideas that you
This
have.
right
You know,
here is a really good way because this is going on Facebook Live, and it's already reached, oh, I don't know how many people it's reached, but the last I checked was like 111, I think.
well, and we've you know been at multiple events, and that, you know, is one of the things that I said when I came on as director, is that I will be as transparent as I can be. If I can share it, I will. And I try to take advantage of any time that we are invited to any event like this to speak, that we are able to do that, to the extent that today is actually my birthday and I'm spending the evening with you all. So
Happy birthday.
thank
Happy
you.
birthday.
So
And thank you.
Oh,
I mean, I
thank you,
really,
Pam.
that
Oh.
is honestly why, I mean, this is important. And this is what you know, this is what we do. And, you know, Alicia and April both are, you know, are also, you know, here to give their time, but we've done Saturday events. We've done, you know, we've done it all, and we'll continue to do that. Just because I don't like when I hear stories like what you told Joe, where people don't know what's available to them or what they can access. So, you know, anything that we could, any way that you can think of that we can get the message out there, you know, we're willing to hear it.
Well, I think you could send a letter or email to every waiver participant and stop relying on the FMAs to train the service advisors, because they get really, really mad when you send them the documents that are up online, or even if you make a request and cut and paste the lines that say these things are allowed, they really get very upset. And I've been told, you don't train me, the agency will train me, or specific people in the agency will train me, and still we have nothing. And it isn't our job to train them, but if they don't know, then, you know, it's human nature to share the information, especially if it's out in writing. But, you know, you could require them to do the training, but that doesn't mean they're not just going to turn the computer on and let it roll through. I mean, I've watched people do that for professional development, you know, in other fields, maybe not this one, but, you know, they know what's in the training and they don't think they need to read it. And so it's hard. But if participants know what to ask for, they can do a better job of asking.
Right, and we, you know, will continue to use the mail. I will tell you all, you know, share with everyone to update their address if anything changes. Literally, when we send out anything to participants, we have an over 50% return mail rate. So if you all can, you know, spread the word. If your address changes, make sure you update your address with DCBS, that you know, you change your address, because those are that's the address that we use, the mailing address that we use. But yeah, I've have been to the point of, do we send postcards? Because honestly, I've had individuals tell us, when something comes in that horse envelope, I don't open it because it's bad news. So how do we make sure that people aren't afraid of what's in the envelope and that they know to open it? So I've thought about, do we send postcards? Do we send flyers? Do we post things? Of course, now we don't have as many, you don't have as many places that people are able to go because of COVID, but we also work with SPIN, and we've done several events at schools and trying to share it with the school system, trying to get it out, even with some homeschool organizations, we sharing it with them, trying to get the information out. So anybody has any ideas, I will welcome them, because it is one of our biggest problems, is making sure the information gets to the individuals that need it.
I know that anybody who has a waiver also has to be in Benefind, and Benefind has both an email requirement and a physical address requirement, and that has to be up to date. And so that should be an easy way to drop information. But if the FMAs are not willing to hear that information from the bottom up, and they're not willing to receive the information from the top down, then people are not served.
That is something that I work on every single day, honestly.
I am so grateful for your work.
Well, and I shouldn't say it's not just me. I mean, it is people like Alicia and April, and some of our other managers and our staff that you all talk to on a daily basis. I'm very fortunate. I have a team that is very dedicated, and that has a lot of experience with waiver.
There are some families that live in parts of the, like Eastern Kentucky also, that have limited access, to internet.
Mm-hmm.
And so I think sending it through, and I don't know what regular snail mail is, if that's any better, but and that sometimes that information kind of gets lost in the not having access, for lack of a better
Right.
way.
Right. It does. And we realize, there are some portions of the state that are very limited access wise. And, honestly, I'm looking forward to the time that we can go back out and do some live sessions. Again, this is great, and you can reach a live audience, you can reach a large audience, but it's great sometimes to be able to see people face to face and talk to them. Oh my goodness, Melanie, he's gotten so big since the last time I saw him.
Ooh,
And he's had a haircut.
yes.
He's a grown man.
Thank you. You're a big boy. Well, I just think that to me, that because I work in an environment where I get a chance to talk with families of young children, and that we work really hard to get them to apply through the process to get on the waiver or the waiting list, and
Right.
and it's very challenging in some of these communities, because they don't have what they call hotspots, to be able to actually access the computer and what's going on internet wise. Yeah. So I don't know what regular mail is like in that part, other parts of the state. If it's good or bad, or they have difficulty with delivering.
Pam, would you
Yes.
be able to put in the chat box your contact info? There's somebody on Facebook asking for it.
Yeah, I can do that. It's simple. Or Alicia or April, one of you all mind to throw that up there? But it is probably, in all of the time that I have worked with Medicaid at the different vendors, this is the easiest email address that I've had, because it's literally just pam.smith@ky.gov.
Okay, thank you. I'll make sure that it goes on there.
And I will say that, especially in this in this time while we are working from home, email is probably the best and easiest way to reach me. There is, through phone, we do have, if an individual wants to call our main number, which is 502-564-7540. We do have somebody that answers that live from 8 to 4:30, Monday through Friday, and she can get to me as well. She can get a message to me, and I can give you a call back. Alicia also has put the help desk number in the chat as well. And they can find me. Anybody can find me. I tell you, it's they can quickly get me when they need me. So, or any of the other leadership staff.
We're getting a question that says, can we ask Alicia to talk about PRFs?
Can you, I'm not sure what you're exactly asking about.
Okay, I don't know. That was Lissa who asked that question.
So I'm asking about the provider relief funds, and the last thing I heard about this was a letter from Alicia, but we're all sort of waiting to hear.
So the provider relief funds, and Pam, did you want to take this one, or did you want me to?
It doesn't matter. I can if you want me to.
Okay, that's fine.
They were so the provider relief fund was federal monies that there were multiple requirements about who could providers that had experienced issues, that might not be the right word, but had difficulties because of COVID with funding, with paying employees, with having access to PPE. There was multiple things that the monies could be used for, but there was a process that had to be the provider had to request the monies, and then us as a state, we had to provide federally the reporting of who, what the providers had billed, number of individuals they served. It was a large amount of information that we had to provide, but it was up to each individual agency. We gave them multiple reminders. That was the biggest thing, that we did, is to remind them and to remind them when the extensions were given, when the new deadline was, about applying for those provider relief funds. But it was up to the provider if they made that application.
So we know that Bluegrass Ad did not apply. Do we know if any of the other FMAs did?
I'm not aware that that any of the other FMAs did. I mean, that was both CMHCs and the Areas on Aging. I'm not aware of any that applied, but it could be that they applied and I just don't know, because we don't typically get into that part of their business. We don't necessarily know. So they may have applied and I just don't have that information.
So one thing that's really clear is the actual extent of the responsibility as a fiscal management agency when they're a pass-through and they sort of stand between PDS employers and funds like this. It seems like they decided that it was not within their scope of responsibility, but because they do batch billing, it made it very difficult for PDS employers who do have expenses that were covered under the Provider Relief Fund to apply on our own. And we're not in a position to assume that we're on the curated list for verification. And I don't know if we're going to be verified or not. We're all still waiting.
And unfortunately, because that's a federal program, I can't, I don't have it. It's not even that I can't say, it's that I don't have the information. All of that went through federal channels, and we don't, as a state, we don't have access to who applied. Any questions that were sent in, we don't have access to that information. It's not something that they shared with us.
We have another question. It says, did any PDS apply?
I am not aware of any, but again, I don't know. It may be that there's some agencies that applied, and that's the same on the traditional side too. I honestly am not aware of who applied and who didn't, on whether it be, you know, the FMAs on behalf of PDS employees, or the traditional agency. We just don't have access to that information. They didn't share that with us.
Do you want to talk about PPE and ways to access PPE if you are able to get caregivers to come into your home?
So we did make the allowance through Appendix K that individuals could use goods and services, or depending on the waiver, sometimes it fell under specialized medical equipment. The definitions vary just a little bit, waiver to waiver, but that individuals were able to use those funds for PPE, for either the individual themselves or caregivers coming in the home to provide services for the individual. And I will say that some of our reviewers have gotten to be very good at finding, because there's been, you know, at different times, there's been trouble actually finding some of the PPE. And so with some of our reviewers, our nurses in particular, have gotten very good at helping some of the case managers and support brokers find PPE.
Okay, we need PPE and we are not good at finding it. And you know, especially if I am able to hire this woman, that's so important to me.
I will. I'll add that on my note. Listen, I'll check on. I can check on that for you as well.
We have another question. Does PPE count towards the max amount?
Right now, no. We have actually lifted that max amount right now. So it will not count towards that. And the monies that are spent during this state of emergency will not count towards that. It's almost like for those limitations that the period that we're under, Appendix K doesn't count. So it's not like all of a sudden you're gonna, you know, we're gonna go back to, you know, life as normal, and, you know, somebody's gonna say, well, you only have $100, or you didn't use, you know, you've already used all your money. It'll be like this time period didn't exist, really. I mean, that the dollars that are spent won't count towards that maximum. It'll be what was spent from January to March before we declared. So at the beginning of March, when we declared, the state of emergency, and Appendix K became in effect, which I believe it was March the 6th is the start date. And then whatever date that Appendix K ends, it'll move forward from that period, and the money spent during this period will not count.
You guys ask questions, or I'll just keep asking questions.
That's funny. I don't see any other questions on in the chat box or on Facebook. Do you have more questions, Lissa?
Should we sing happy birthday to Pam Smith?
We should totally sing happy birthday. We should probably embarrass her on Facebook Live. No, I'm just kidding. We don't have to embarrass you.
Maybe our best
Thank you
gift is
for
not.
the sentiment. I appreciate it. And again, this is truly what I love. This is my passion. Or I've said I don't know if it is a sickness or it is a true love to work for Medicaid this long. But I'm going on 27. Actually, just hit my 27th year. So
Wow.
yeah,
Happy
I started when I was in kindergarten.
Mm-hmm. Yeah. Yeah.
Wow.
That's unusual, but yeah, totally see that. I think our best gift to you is not to subject you to singing happy birthday. But wow, you really know how to plan a party.
I know, didn't I? I have a Facebook Live and everything. So
Well, I hope you at least get some cake and ice cream tonight.
I did. My husband was very sweet and brought home. He said, I didn't know if you'd want cheesecake or cake. So he brought home chocolate cake and cheesecake. So don't tell. I may have some tonight and some for breakfast. So, and I said my best birthday present was my grandson just on his own decided that he was going to start using the potty after refusing for what seemed like forever. So.
Oh,
Yay!
no.
Yeah, so yay for potty training. So
that's a
You
huge.
can survive it.
I was beginning to wonder. I thought surely I've survived two boys that are now in their 20s and didn't have this problem, but he was just very stubborn and he just said no. He said, I don't think so. He said, Nana, I don't think so. So, the pediatrician said, just leave him alone and he'll do it when he's ready. And so that's what we did. And he did. So I have to tell her she was right. So.
And he's only 12 years old.
Exactly. Yeah. He's only in middle school. No, he actually will be 4 next month. So he held out a long time, but when he decided, then that was the end. He actually has had no accidents, knock on wood. So.
Awesome.
I'll do it for you. I've got some wood right in front of me.
So I am going to tell you guys that I have been going back and watching the earlier videos from like April, and you've really pulled together the Zoom thing so brilliantly, and I am impressed. And like I did a doc program that was a blended model, and you guys have pulled this together faster than all the professors I had, and you should really be proud of yourselves for doing it so well.
Who are you talking to?
Right, me too. I was wondering.
I am talking to Pam Smith,
Yeah,
and April Lowry, and I don't know that I've watched Alicia on Zoom yet, but if you watch the early COVID trainings up through the modern day, and who is that other girl, Kelly?
Kelly, yes.
She has gotten so good at it, and I'm really proud of you all.
Thank
this
you
is not
very
like
much.
something they trained you for, unless they did, and I don't need to know, but whatever. You're doing a good job.
We are very fortunate to have Kelly. I've told her she cannot ever go anywhere else because she is everything communication extraordinaire. She is the absolute backbone when it comes to communications. We're very lucky to have her.
Kelly takes the notes on the meetings and updates the FAQs, if you guys don't know that.
that's good to know. I did not know that.
She's brilliant.
Mm-hmm. Melissa, do you have more questions? Or does anybody? Melissa, come on. You really, it actually progresses the meeting if we hear your questions.
Grown-ups.
That's why you're formulating questions. You just want to have a conversation.
Well, all right. So Melanie asked really early on, what is MWMA? And it's such a good question. Like, we need basics too. Like, what exactly is MWMA?
Okay, let's see. I'll give you the quick version of. So MWMA stands for the Medicaid Waiver Management Application. It is it's meant to be kind of the one-stop shop for providers for waiver. And it kind of started rough, to be perfectly honest. We have been making enhancements to it for the past, 4 years, probably over 4 years, to make it more user-friendly. But it really it shows providers, it's where they request prior authorization for waiver services, but it also connects to Benefine. So, for example, I was in it earlier and I needed to see a communication that had went out to an individual, and so I was able to connect to Benefine and I could look at the communications that had been mailed. It has role-based security, so based on what your role is in the organization, what you have access to and what you can see. So for example, I'm an administrator, so I pretty much can go anywhere in the application, whereas when you get down to the case manager or to the direct service provider level, they may only be able to see information related to them. It includes, the individual's plan of care, their goals and objectives. There's a section that deals with their state plan services, so that we can see, in addition to the waiver services, these are services they're accessing through the state plan. That helps us when we're helping case managers troubleshoot on what supports an individual may want to access to help address needs. We are rolling out that critical incident module, so that allows us, we'll have that information in the system there as well. I'm thinking what else that it really it lets them see. So when a case manager, and this is one of our newest enhancements, when a case manager or soon to be direct service provider needs to do, there's a modification or they need to know, how much of a service has been accessed, it will actually make a call out. So it's connected to our Mmis, and it will show the earliest date something was billed, the most recent date something was billed, and how much has been utilized. And that's based on dollars or units, depending on the service. So it's come a long way. And we still have more enhancements planned for it. We are rolling out the case managers right now can do this. Direct service providers will be able to print those letters, the PA letters, on demand. The other thing that they can do, which is really neat, is that they can save the PA letter. So instead of them having to mail that letter out to you, they can send it through secure email, and you can have an electronic copy of your prior authorization letter.
We have 2 more questions in the chat box.
Okay.
One of those questions is, can you do a quick summary of each waiver program and target population? And I'm going to go ahead and tell you what the other one is too,
Okay.
because it might be easier to answer the other one first.
Okay.
The other one is, what is the difference between MWMA and MMIS?
Okay, so MWMA is specific to the waivers. The MMIS is actually the claims payment vendor for Kentucky. So if you've heard of DXC, that is who the MMIS is, or they've also been named, let's see, while I worked there, they had, I think, 3 that they were EDS, they've been HP, they've been HP Enterprise Services, and then now DXC. So they've went through multiple name changes. Interestingly enough, all of them had initials in them. But so what they do is they actually process all of the claims and do the issue all the payments. So anything to do with that, with the payments and with claims. And they do that for all waiver services, all state plan services. And they also receive that information from the MCOs, even though they don't pay those claims, they receive that information so that they can do, we can do reporting and have that information on what's been paid by the MCOs.
Is that location still in Winchester?
No, they are actually in Frankfort.
Okay.
There was one at one point in Winchester. There also was an office at one point in Lexington that were different. They actually did different functions. The Mmis has actually always been in Frankfurt. Now, as far as the waivers, so we have 2 waivers that serve individuals with acquired brain injuries. One is more acute. It's meant to treat individuals that are more recently injured. It focuses more on rehab. The acquired brain injury long-term care waiver is meant for individuals that are longer post-injury or individuals that are going to continue to need long-term supports after maybe that rehab period is over. So, you know, they maybe are always going to need some additional supports in order to in order to be successful in the community. Then we have Hcb Waiver. That target population is our older individuals, so it's 65 and older, as well as individuals with a physical disability. We serve about 12,000 people on that waiver now. It is probably our fastest growing waiver at this point in time, but it focuses more on like home-based services, more of like the homemaking, the attendant care, personal care type services. Then we have Model 2 waiver. It's our smallest waiver. We can serve up to 100 people. Right now we're serving about 35 to 40 individuals. That is individuals that are dependent on a ventilator. So a lot of times we get preemies that come out of the hospital, and those are really the exciting ones because we get to see them grow out of the need for the ventilator, and they kind of graduate from Model 2. But we also do serve, there's some adults on that waiver as well that either have had some type of spinal cord injury or have some kind of respiratory disease that affects their ability to breathe on their own and need that ventilator. And then lastly, we have SCL and Ppe, and both of those target intellectual and developmental disabilities. The main difference is the amount of services available. So in SCL, we also have residential available that we do not in Ppe. Ppe has the limit of 40 hours a week that the individual can receive, as well as those plan of care caps. And so that, in a quick nutshell, is the waivers and who they serve. So right now, we are down to, we actually are allocating our last individuals on the ABI wait list. And so pretty soon we will not have a wait list on either one of those. We still have the wait list for SCL and Ppe. And we continue to ask for slots. This budget, for this most recent budget, we were not granted any additional slots, despite, you know, all the justification that we provided. So, you know, we still are looking for ways to, that we can serve as many people as possible.
I have one more question.
Okay.
I understand from the town halls that employees and caregivers have access to MWMA, and service advisors and the FMA administrator or the TELUS administrator at the FMA, but parents and representatives and legal guardians and participants don't. Is there anything in MWMA you would not want a parent or caregiver, I mean, any of those people to see?
No, and they, I'll have to, unless Alicia knows off the top of her head what actually the parent has access to. I know that they have access to the plan of care, which includes goals and objectives. It would show the prior authorization. They have access also to see that service usage data that I talked about earlier. But we can, I can get that information and can provide it. I honestly just cannot remember off the top of my head what the differences are.
So I think that it would be really fair and help us as parents to kind of watch over the well-being of our kids or our parents or whoever it is that we're caring for, if we also could review the things that are going in. And it has been hard over a number of service advisors to get access to any of the records. Sometimes I've been told no on the plan of care. And, you know, that could just be my agency. But if this stuff is going to be through EVV, all sort of home-based in MWMA, I think that parents, legal guardians, and representatives and participants should at least have the same access as some employee that you're hiring off the street. I mean, like that's absurd that they would have better access to a patient's data than the next of kin.
So we can, we'll get out the information about who has access to which parts. One thing that I do want to though make clear is that EVV and MWMA are two separate, completely different applications. So the amount of data that's in MWMA is much more detailed, and there's much more information than what is in EVV.
We have another question. The question is, how many are on the SCL waiting list and how many are on the Ppe waiting list?
I have, and I just pulled out from actually a presentation that I did earlier today, and these stats were as of the beginning of September. Ppe, there were 7,305 on the waiting list. SCL, there's 2,891. The one thing I will say about the SCL waiting list is that it's managed in different categories. So the large portion of that 2,981 are actually on the future planning list. So they're individuals that aren't even saying that they want services or need services right now, but they want to be on that list in the future, so that, you know, when it comes a time that maybe that they don't have, you know, their parents aren't able to take care of them anymore, or their circumstances change, that they'll have access to that slot and will be able to apply for an emergency spot. We actually do not have anybody on the emergency waiting list right now in SCL.
And I have one question. Actually, there's another question, and then I have a question. The question is, are all those individuals in HCB2?
Some of them are and some of them aren't. So some of the individuals may also be getting just state plan services. They may be enrolled in an MCO, or they may be receiving services through EPSDT. But yes, some of them are actually receiving services in HCB2.
So with the home and community-based waivers, is there like a list of providers that are in Lexington, or is there a way to access that?
April, can you take that?
Pam, yes, I will put the link to the directory in the chat.
Thank you.
You're welcome.
Joe, do we have any other questions?
I don't see any on the Facebook, and I don't see any in the chat box either. So no, not at the moment.
Okay, I will get the presentation out. Melanie, I'll send it to you, and if you can distribute it. And then again, I encourage you all to go to the website. All the recordings are there. You know, there's a lot of good information there. And then, you know, reach out to us with questions and, you know, with comments. And just, you know, let us know if you have any ideas, or, you know, or if you're having any difficulties with services. And Lisa, I know I owe you some follow-up, so I will reach out to you to specifically talk to you about some of the issues that you were having.
Thank you.
And then Joe, I'm also gonna post a separate. So right now the posted is the DMS provider directory, and then I'm also going to post a HCB case management and a HCB direct service provider links too.
Okay, thank you.
Okay.
Are we done, or should I ask another question?
If you have a quick question, I think you should ask it quickly, and we'll let Pam.
Yeah, because it's
enjoy your
already 8:34.
It is.
Can a service advisor from another agency do the application for a different waiver, or can that only be done through the ad? I mean, we're the Autism Society of the Bluegrass, right? So BGADD is our ad. But can I have a different agency do a different waiver application, or does it have to be my ad?
So for the actual application, there, any of the ads can put in those applications. As far as assessment and being a service provider, we don't restrict them to providing services only within their region, but that most of them don't want to go outside of their region. But that is one of the things we're trying to expand, that you'll see in the waiver renewal that's coming out, is what I've talked about earlier about adding the CMHCs to try to expand who can do that, who can do those services, or function as a support broker.
Add independent agencies, because our CMHC doesn't have a great reputation either.
We, for this round of updates, we're not able to. That is in the plan. For the future, we have to finish the rate methodology study and put that into place before we're able to do that in HCB. But that is the plan, to do that in the future, to expand it out and let any of the really break out. Right now, the support broker and the FMA services are bundled together in a rate, and so I can't split those until I have till we finish the methodology study, so that I can do that in HCB2. But that's the future plan, is to be able to split those services and allow for it to also be other independent case management agencies.
Happy birthday.
Thank you.
Pam, thanks so much. And April and Alicia, thanks a lot for your time tonight. If anybody else wants to stay on while we give Pam a reprieve so she can have some part of her birthday, you're welcome to stay on for a couple of minutes. But otherwise, if nobody else has anything to ask, we're going to let her have her evening back.
Thank you all very much. And again, thank you for the opportunity to speak with you all. And I'll get this presentation sent to Melanie so that it can be shared. And anytime that we can come and speak, we're more than happy to do that.
That's great. We'll wait until April's birthday.
Hers is coming up this fall, so
good.
Hers is
she has her plans.
All right. Thanks, everybody.
Thank you all so much.
Happy birthday.
Thank you.
Happy birthday.
Thank you. All right,
Melanie,
bye-bye.
thanks for setting it up. And Joe, thank you for setting it up. Bye. But if anybody needs to stay on and discuss anything more, that'd be fine too. April is welcome to also. But I don't know if anybody has anything else to talk about. But Joe, how are you feeling?
Oh, I'm fine. I'm fine. But yeah, if anybody wants to talk about anything they don't want shared publicly, let me know and I'll take this off the live.
Oh, okay. We're still on live. Well, okay, then you don't have to talk about it. All right. Anybody have anything else to talk about regarding tonight's topic or any other autism related topics at all?
No, I have Heather's flyer that I can send. I don't.
Okay.
I'm trying to find her contact information.
All right. You know what? That's all I needed, Mel. That's why I was asking you for her contact info. When I tried to copy the flyer on Facebook, it came attached with dumb stuff like, you know, the header with the time of day and stuff like that. So
Okay.
I'm trying to put it into an email to send to the listserv.
Let me, I've got her flyer at work. I can scan it and send it to you.
Well, if it'd be easier for you probably just to give me her contact info and I'll not make you do all that.
Well, I'm struggling to find it. I have it.
Joe, do you have it? I know that at some point I found that she contacted you in July about this tennis workshop thing. But it might have.
I don't know if I have it.
I can't even find her Messenger account, and she has been contacting us through Messenger, or through Facebook. So I would think, doesn't that automatically confer a Messenger account? If anybody came in after Heather Richardson spoke, she is promoting Acing Autism, which is a workshop, a tennis workshop for kids with autism, people with autism, ages 5 to 18. I'm surprised that flyer didn't have her contact info, but I don't think it does.
I don't, yeah. I'm looking in my email and I don't see anything from her.
Well, no.
Do we have a meeting, a topic for next month or not yet?
We do, and I'm just trying to think about what it is.
Oh, wow, good job, Mel.
Well, no, I can't remember it, so that's not.
Well, if you don't remember it, we'll just have an open chat.
I do think that the people that wanted to talk about the there's a group that Tammy Hammond Natoff and McGinnis, they wanted to come and just talk a short amount of time. It's the support group for individuals with high functioning autism, Asperger's. I can't remember anything. I'm sorry, my brain is.
We're coming really close to your bedtime. I know.
It's been pointed out to me that we're still on live. Would you like for me to end the live?
Okay, end the live, please, before I say anything.
Okay.